My name is Gary Painter, and I'm the director of the Homelessness Policy Research Institute, which is a little bit of a mouthful, so often called HPRI. As many of you know, HPRI convenes researchers and policymakers to help design and coordinate timely, relevant, and actionable research to end homelessness in Los Angeles County. And our work has four primary foci. The first is to foster collaboration and coordination among researchers focused on homelessness in Los Angeles. Second thing is to conduct rapid response policy research to inform policy and program design. Third is to assist in developing and coordinating requests for proposals for homelessness research. And finally, to translate this research and research throughout the country that's happening to policymakers and community partners to inform their work to end homelessness. In front of you, there are table tents with the HPRI website and address if you want to learn more about the institutes, where we archive some of the policy research that we've conducted to date. And we're coming up on our 1-year anniversary at the end of June, so we're excited to have been part of this work and a partner today. Today is the third Research Symposium that we've hosted here at HPRI. These events provide an opportunity for the research and the policy communities to dive deeper into a particular research topic, some of which you may know a lot about, and others of you in the room are really excited to learn something much more about trauma-informed research and resiliency, like myself, who have not done research in this particular area. So what we're going to do today is first we're going to have Dr. Roya Ijadi-maghsoodi and Dr. Sherry Weeks from UCLA present new research related to this important topic. We will have a brief Q&A, just 1 or 2 questions after that research presentation before moving into a panel discussion moderated by Joelle Greene, who's the director of Hartman Company. The full list of panelists is included in the program. But before the research presentation, I want to quickly welcome Chris Coe, who's the director of Homelessness Initiatives from the United Way of Greater Los Angeles, who is our partner in HPRI, to provide some welcome remarks. Thanks, Chris.
Good morning. Welcome back to work. Did anyone work yesterday officially? Glad you didn't, but welcome back. It's good to start this week off and start this season off with this important topic. Trauma and resiliency are some of those things that in our world and policy we hear mentioned almost constantly now. But I think the frequency of its mention is different than how much people actually understand what the term is. And so I think more and more we see in policy discussions the requirement being added for things to be trauma and resiliency informed. And recently at the Policy Council at LAHSA for the Coordinated Entry System, a couple of us raised the question of what does that requirement actually mean? What does it actually mean for something to be trauma and resiliency informed? And so we took a pause and with our partners at LAHSA co-convened an exploration with one of the ad hoc committee members on Black homelessness, Veronica Lewis and Amy Turk, who had been overseeing the trauma and resiliency workforce and task force that the Downtown Women's Center had put on, especially for survivors of domestic violence, to talk with practitioners and other people about what does this mean so that funders, policymakers, other folks can actually understand and put into practice what that means. Because I think on the policy side, I would tell you on behalf of some of the other policymakers, there is more of a willingness more than ever. I don't think it's for lack of understanding the importance of it, but I do think it's a lack of understanding what the it is. And so Roya is part of that group, and we're starting off this task force. So this conversation comes at the perfect moment, and I think we all hope to come away with a sense of when we say it's important, what exactly is important about it? The it itself, what kind of traumas are we talking about here? And what are the actual policy and practice implications? So I hope the panelists through their conversations, but you also through your questions will help us unpack that, and hope we can be safe in this space together and be honest about the things we don't understand about this for the sake of what we're trying to actually implement here. So thank you for joining us, and I will turn it back to our HPRI host.
Thank you, Chris. So I just want to briefly introduce our two presenters. I mentioned their names previously. Dr. Roya Ijadi-maghsoodi is an assistant professor in residence in the Division of Population Behavioral Health at UCLA and is an investigator at the Center for the Study of Healthcare Innovation, Implementation, and Policy within the VA Greater Los Angeles healthcare system. Dr. Ijadi-maghsoodi's research concentrates on improving care for under-resourced youth and families in the community, including families experiencing homelessness and youth at risk for trauma. Dr. Sherry Weeks is a senior clinical training manager at the Prevention Training Center of Excellence at the Jane and Terry Simmel Institute for Neuroscience and Human Behavior at UCLA. Her research interests include developing ways to assist underserved populations, especially children and families, to assess quality medical, psychological, and educational services. Clearly, these are two scholars that are well positioned to teach us today. Please join me in welcoming Dr. Ijadi-maghsoodi and Dr. Weeks.
Hi, everyone. Thanks so much for having us today. I'll start off by talking, and then Cherie will join me kind of partly through the presentation. So as mentioned, we're from UCLA. I work at the VA, actually in a homeless patient-aligned care team, a multidisciplinary clinic focusing on homelessness. And then my research is on family homelessness. So I wanted to start by just giving a little bit of an overview of my research. And I'm a child psychiatrist, so I think a lot about mental health, trauma, and my work has been trying to understand the needs of families experiencing homelessness in LA County and how do we adapt an intervention and deliver an intervention to these families. And then Dr. Weeks is going to talk about our new UCLA DMH Prevention Center of Excellence. And there's a lot of words, but she's going to explain kind of their work promoting trauma-informed care, resilience among different sectors, including homelessness, and ways she can be of help to you. And you'll probably hear a lot more about that on the panel too. So. And I received funding from NIDA for a Career Development Award for this work. And I also have a pilot grant funding to look at families involved with DCFS as well. So just have to acknowledge that. So what we know is for families experiencing homelessness, we know there are high rates of trauma. And I know I'm preaching to the choir because you're all well-versed in homelessness. And there's also high rates of substance use among families, among parents and kids. And these intersecting challenges really place these youth at risk for poor mental health, substance use, later homelessness, DCFS involvement. And so that's really why I'm interested. How do we stabilize these families? How do we address the housing issue and then also address the within family issue as well of challenges that can occur? And as I said, kids who are experiencing homelessness, they're at risk for poor health, mental health problems, substance use disorders, out-of-home placements. The list goes on and on. Academic failures, not finishing school, juvenile justice involvement, and then unfortunately later homelessness as well. So I wanted to share some quotes from families that we've been working with. And so we interviewed families throughout LA County. We interviewed parents, kids, and we also interviewed homeless service providers. And we found all these different paths to homelessness, all that involved trauma and a lot of stressors. So this is an example of a parent's path to homelessness. And one parent said, "When I first had to move, I had to stay with a friend. Her landlord was like, 'Well, they're not on your lease, so you have to put them out.' I got a place and the place wasn't right for my baby. She came up with lead poisoning. So the doctor was like, 'Well, I have to call the people out on you.' They were like, 'Well, you have a decision. Are you going to stay here and get your kids taken away, or are we taking you to a shelter?' My decision was I cannot get my kids taken away. And I was like, 'Hey, just take us to the shelter.' We went to the shelter and there was a lot of stuff going on. So after 2-3 weeks we were there, somebody got killed downstairs. So I'm like, okay, we're going to go to a room. So I cleaned my whole savings and went to a room, a motel. And so all these different, ways that this parent could have been helped and the challenges along the way are apparent here. And here's another path to homelessness we see among families. One parent said, "I was staying with my mom and my sister. My mom stopped paying rent. My sister moved out." So we see that a lot with families having to split up or the housing situation changed. And we were staying in a 1-bedroom and the rent was $1,000 and I couldn't do it by myself. So that's what made me become homeless. It was hard to explain to a 9-year-old why we had to move to a shelter and have to keep living from place to place. He was like, "Hey, Mom, I've been to 3 schools already. When are we going to settle in and not move me to no more schools?" So it's risk on the child as well. School transitions, moves. And so what I'm working on is developing a program for families experiencing homelessness to address the stressors, to address the trauma. And we're adapting a program called Focus, which has been shown to improve mental health among families who are stably housed. So that's what we're trying to take all these information from families to adapt the program. And our goal is really to decrease family stress, improve coping in spite of all these stressors. And we could spend a whole day talking, I guess, about the elements of a resilience intervention. And so I'll just touch on it really briefly. But really what this intervention does is it teaches 5 resilience skills. And so we teach emotion regulation, problem solving, communication, setting goals as a family, and managing reminders, which is for our clients and our patients, it's really managing stressful reminders, trauma reminders, teaching families how to do that. I don't think many of us really have learned how to do that ourselves either. Working on a narrative timeline, so really kind of understanding each other's experiences. So in the families we work with, we see separation, we see DCFS involvement, and helping families, parents and children understand each other's path and kind of what was going on as well. And this leads to family resilience and coping. And the reason we need these family-based preventive interventions to increase resilience among these families is that children exist within a family system. And so people don't live in a vacuum. And so we have to work on the system the family system as a whole. And then from lots of research on resilience, we know that supportive and responsive parenting is the strongest protective factor for kids. And so that's what we want to try and promote among families. And there's unfortunately a lack of evidence-based programs for families experiencing homelessness. There's not a lot of it out there. And so for the first phase of my study, we went and did all these interviews with parents and kids, and that's what I wanted to share with you today. Some of the findings that we had, what the families told us, and what this can tell us about trauma-informed care and our practices. And I worked mostly with families in transitional housing, and as you can see here, there's a range of different housing situations that you all probably work with families as well. Doubled up, couch surfing, rapid rehousing, and the reason this diagram looks like this is that although families that are living in permanent housing, they're stably housed at this point. They've already gone through these range of really stressful experiences. So getting to permanent housing can also involve all of these stressors along the way. So we did 56 interviews. We interviewed parents, kids, providers throughout Los Angeles. Our median length of homelessness was about 12 months for families that we worked with and interviewed. And parents had about 3.4 children under their care on average. So our first finding, and I'm sorry I keep saying the word trauma because I know we're trying to focus more on the resilience part too, but the trauma part is so important. We found that trauma is pervasive, which I'm sure all of you are aware of. So most of the parents we interviewed had really traumatic experiences in their lives, some preceding homelessness. This quote is from a mom who said, "My first son passed away. I was very young. I was 15. He passed away at 6 months, and I never got help for that. I never got therapy. I didn't process it. I was a mess. That's when I started smoking weed, and then after that, it was the meth for about a year." So just seeing these really traumatic experiences, loss of children, childhood trauma preceding homelessness, preceding substance use, and really trying to keep that in mind. We also found, we say guilt permeates all parenting. And I'm aware of this because I have an 18-month-old, and so I've started to realize how much guilt I feel about everything all the time. But really, for these families, they had past substance use, there maybe had been a separation, or a child had been in foster care, or living with another parent or grandparent. And this really interfered, even when families were reunited in transitional housing, there was this guilt kind of overlaying everything, and that affected parenting and affected communication as a family. And providers said, we're seeing this, and we're not quite sure how to address this among parents. So for an example, one mom said, "I regret letting all that time go by, and my addiction and my homelessness. I would have gotten my kids back, my housing back. It took me 9 years to do it." So really, parents just thinking about all this time that had gone by and what had happened in the past. And then the part of disclosure. And so we always say trauma and substance use go hand in hand. So we see families or individuals using substances to help cope with this trauma and these experiences that have happened. But unfortunately, and many of you who work with families know, parents are afraid to disclose substance use or past substance use. They're afraid of Child Protective Services involvement. They're afraid of their housing providers or future housing issues that may arise. And they're afraid to disclose to physicians too. I had a parent explain that she had been using meth during her pregnancy, and she really wanted to tell her doctor, but she was so afraid. So she just kept Googling what would happen if she was using meth. And that was just really heartbreaking to me, because the doctors are there to kind of support somebody through your pregnancy. So this leads to a barrier to treatment. And then this also really concerns us when families obtain permanent supportive housing, because if there's not these supports in place, they are at risk for relapse or for worsening mental health, because stressors do continue. And then we also found households are in a pernicious environment. So families are not only struggling with their trauma and their, communication and working together as a family, but then they're in this kind of minefield environment where there's lack of affordable housing. When there is affordable housing, it's confusing on how to obtain it or how to kind of work through the system. Families talked about racial discrimination that they encountered when they were trying to get housing. Families said they didn't have enough time in transitional housing too. They felt like they needed more time to get on their feet, to get supports. And some parents that I interviewed, even though they'd been offered rapid rehousing, they were really worried. They were worried that they weren't going to be able to sustain, and that after 6 months of having rent paid, they couldn't continue to pay the rent. So families really worried about the environment they were in, and we do too. All of us working in this area, that there's so many obstacles and barriers for families. And then parents need more support. So this parent said, I think all programs should have their guidelines, but when you're dealing with women and broken women and children, it should be a whole another ballgame. Like, you just need to, have your certain guidelines, but be flexible with certain situations. And I thought this was really important. So, and this parent, unfortunately, she felt they were broken because of the experiences they've been through, but she was also saying, people need to take into account our experiences and in a non-judging manner, and be receptive to what we need. And I think that's really the basis of trauma-informed care, and as organizations, and really being flexible with families and really offering choice and offering support. And some of the things that they called for, some of these recommendations, was more awareness of how stressful experiences could really affect children's behavior. So parents who have children were constantly afraid that their child was going to get them in trouble, or their child's behavior, or their child was acting out because of trauma or stress, and afraid of how, when they were interacting with services, that the children could affect their care as well. They called for this flexibility with working with families, that maybe they couldn't do things in the right amount of time because of they're dealing with their family situation and trauma. Advocacy, they really called for advocacy, and what this meant was helping families navigate like the school system, navigate housing, having providers provide case management, but also a lot of support and guidance. And then they really asked for on-site family therapy and counseling. So a lot of individuals we work with, they do have access to mental health care, which is great. But a lot of times we weren't seeing mental health care available for the kids or for the family, as family therapy as a whole. So our next steps is we've adapted this intervention. We're going to pilot test it in LA County this summer. We're also trying to incorporate families with DCFS involvement to try and prevent future separation for families. So let me call up Dr. Weeks too, so I know we're running out of time. So Dr. Weeks so we work together at UCLA. And so she's going to talk more about this new Prevention Training Center of Excellence, which kind of incorporates kind of what I've talked about, our findings, and how do we put this into action in the community? How do we help support trauma-informed care? So thank you.
So as Roya told you, I work for the University of Los Angeles, and we work for the Prevention Training Center of Excellence. It's a long name, and it really just means that we are a partnership between DMH and UCLA, and we have been contracted and we partnership with them in order to go out in the community and teach about trauma and resilience informed care. So it's like you said when you came up here in the beginning, we talk a lot about it, but what does it mean and how does it translate? My boss can come in and tell me, hey, this is what we're doing now. This is a new initiative. This is the new push. It was kind of like client-centered therapy. We were doing that. And sometimes we didn't know what that meant either. And so what our charge really is to do is to translate that into something usable for the boots on the ground. And I think that's the part that's most important to me. And so what it was is it's this partnership, and we have this time where we go out into the community and we really teach about it. How do we do that? We take some of the research, the things that we've heard, the things that Roya was talking about, the parent 6 that said, oh, I need certain situations to be flexible. Well, that's one of the pillars of resilience is flexible, a choice, giving people choice and empowering people. She talked about advocacy. That's really empowering people. That's really rebuilding their resilience. Rather than looking at a person from a trauma-informed lens when they come to you with behaviors, it's really looking, what are their strengths? And how do we go and build those strengths to get them toward more permanent things? And so one of the things that we do is we do this programming and these trainings for professionals, but we don't just do it for clinicians. We do it for everybody. And the good thing about it is it's free. So last year we had a charge to train 5,000 people, and I think we've trained almost 10,000. Next year our training initiative is 12,500 people that we're training. We go into these agencies and we do it, and it's free, and they love it, and we come back. It's not proprietary. We help them to build and really change their programs. And so participants do these trainings. It's not just live trainings, though. So once you've come in and you've had a live training from us, then we also have a learning management system. So those are for people who can't get to us or people who've already been through the trainings. They can come back online and they expound upon that. We go even bigger. We don't just work with the therapist or the psychologist at UCLA. We work with the law school when we need to know about legal situations. We work with education when we need to talk about how to do this in schools. We really are utilizing a broad sector of individuals and professionals to inform these trainings. And so they've been really well received. We also go into agencies and we do consultation and coaching. So if there's someone within an agency that says, or we identify, or they self-identify as what we call a champion, we help them to continue to expound upon this and train people, because as you know, there's a lot of turnover. We also train about secondary traumatic stress and professional well-being because of the turnover. And so we're really excited to be doing this work. And I want to just tell you a little bit. Some of the things that we do are our training topics. We've trained on resilience-informed care. That's kind of our baseline, the foundations. What is it? What does it mean? How do you translate it? How do you change the entire agency? Not just what you do, but from the moment I walk in the door, how do you make me feel received? When we talk about homelessness, a lot of the sectors that I'm the manager for, they go across the spectrum. So I have prevention and aftercare. Those are DCFS involved families. I have libraries. We have a lot of veterans. We have a lot of homeless veterans that come into libraries as the last bastion of public space. I'm also in the next year we'll be training developmental centers, because we have a lot of people with developmental disabilities that will be homeless. California is doing a lot of great things to make sure that they have choice in their lives, but one of the things that it might lead to is an increased number of homelessness. You would think that they'd be a protected kind of group, but they're not. One of the things we do, one of the things that's well received is we do this, what we call a gallery walk. And it's where the agencies come together and we start to talk about these pillars of building resilience and what that looks like and how do you create that within your agency. And they have ideas and they come and they talk about these ideas at their table. They say, well, I'm already valuing people's culture by doing X. And I'm already valuing their safety by doing Z. And then we get them and they write them on the walls around the room. And it's one way to keep that conversation going about how to really shift an agency's thinking and practices. And it's been really valuable. We started off, we thought, this exercise will take 20 minutes. This exercise takes close to an hour, because we can't stop them from talking once you start to get the ideas in there. One thing I'd like to say, because I'm running out of time, is that we don't just train the people in the agency. I talked about doing the boots on the ground, but we train everybody in the agency who's client facing. That means the lady who sits at the front desk and the guy who sweeps the driveway. And you would be, it always warms my heart to see the facilities guy sitting there who probably never thought he'd be doing this kind of work, who never thought that he or she would be thinking about this at work. really engaged in these conversations and really excited to learn more. We do implicit bias training. We do all kinds of stuff. And it's just exciting to me because one of the ways I sell it is I say, we're going to train everybody. We're going to do it for free. And you're not going to just send 4 people and they talk about it amongst themselves and nobody ever talks about it again. I want everybody in your agency there. That conversation continues. It continues in the agency. It continues outside of the agency. It continues at your sister agencies. And that's been just really exciting for us to do and to see people really resonating to what it is that we have to say. Because I think we get into this business to do the work, and then sometimes we get a little demoralized because we need the tools. So thank you.
So we have time for just maybe 1 or 2 questions here. We're going to have a Q&A time as also at the end of the panel. But are there any kind of 1 or 2 questions for? Yes.
I'm also do trauma and resilience informed training, and a big problem I see is that we're training frontline workers, we're training the forward-facing folks, but we're not training organizational leadership. And so we see that I firmly believe that if the way that the staff is treated in the organization will roll down the hill to the client. And so I'm wondering what kind of training, coaching, organizational support you're doing for organizational change at the higher levels to integrate these principles into administration and management.
So that's a really good question, and it makes sense, right? I think it makes sense to everybody. And I might show my age here a little bit when I say this, how I'm going to answer it for you. Yes, we train administration, and we train administration in the room with the boots on the ground. Why do we do that? Because when I talk about these pillars of building resilience, I'm not just talking about the people they work with, but the people who work for them. And I probably hurt some feelings and step on some toes, but they keep having me back. So maybe it's the way I do it. But I talk about, hey, this is an agency-wide thing. You cannot say we're going to do this for the community and not the people who work here. It's the administration who lets me in the door. So that's who I talk to first. But they're right there with the facilities guy at the same table doing this work. The one thing I'll say, and this is where it'll date me, is that it actually is rolling. It is a trickle-down effect. It's actually working in this instance, in that we are seeing these shifts in agencies. Once they've gone through a series of trainings, they're coming back and saying, hey, will you sit down with me? Because the first thing I ask them is, do you have a work plan? What's the plan? Like, I can come in here, somebody probably came last year, somebody will probably come next year, but what does your work plan say? And some of the agencies, it's shocking. They're like, work plan, what's that? And I go, oh, hey, I'll come back and I'll sit down with you and I'll be your coach and I'll help you write this work plan. And we will have a work plan that has firm deadlines that talks about this shift. And you will share this with the people you work with and who work with you. I don't like to say work for, you're a team. You'll share this with your team and you will hold each other accountable. And when we get stuck, I'll come back. And we'll see where we're getting stuck and how we're getting stuck. And the thing about it is I like to, and this always helps them to hear it. It's not going to cost them anything, not just my services, but making these changes, they're not costly. Your return on investment is way greater than the 2 hours you have someone sitting in a room to do this training.
That's great. Well, join me again in thanking Dr. Weeks and Dr. ijadi-maghsoodi. So we'll keep moving forward. I want to introduce our panel moderator, Dr. Joelle Greene, who's the director of Hartman & Company. Joelle is a highly skilled researcher and evaluator with more than 20 years of experience in both the academy and nonprofit sectors, and a valued member of HPRI. She has expertise in mixed methods approaches to evaluation. She is an adept facilitator and is skilled at guiding diverse groups through processes of planning and learning. Her own expertise is within the areas of early childhood, housing, mental services, violence prevention, at-risk youth, and elder services. Please join me in welcoming Joelle Greene, and if I could invite the panelists also to come up as well.
I know a couple of our speakers have already acknowledged our appreciation that you would come out the day after a 3-day weekend. So for my part as a moderator, I tried to think of a way to frame this that would be maximally exciting and engaging first thing on a Tuesday morning. So I think you'll all agree with me that the folks sitting at this table and many of you in the room are actually part of our superhero contingent here in Los Angeles. And I think, this is the right time of year to be talking about superheroes, right? We're about to go into the summer movie season and, don't no spoilers, please. I still haven't seen Endgame. But we know, right? It's the season of superheroes. So all good superheroes have an origin story. So rather than introductions this morning, we're going to do origin stories. So I'd just like to start with Charles and just ask us, tell us who you, where you do your work and who you work with in the context of our discussion today around trauma-informed and care and resilience.
Sure. Good morning, everybody. Namaste. I am a healthcare consultant with Health Management Associates. I'm with a division called Community Strategies, and we focus on working with community-based organizations and government entities really focused on the social determinants of health. I have a long 28-year tenure of leading nonprofit organizations, including the Trevor Project, Suicide Prevention, Village Family Services, Behavioral Health, Child Welfare, Homeless Services, and federally qualified health clinics. So that's been my genesis of the career. And all of the organizations that I've been at, we have implemented, to the best of our ability, a trauma-informed approach.
Good morning, everyone. My name's Elizabeth Eastland. I'm the Executive Director of Rainbow Services, and we're a domestic violence organization in the South Bay of Los Angeles and the Harbor area. So we are a part of the city of Los Angeles as well. We've been around for about 36 years and providing support and shelter to victims of domestic violence. Rainbow also co-leads the Domestic Violence Homeless Services Coalition along with Downtown Women's Center. I'm chair of the city's Domestic Violence Alliance, and I started my social work career working with Skid Row Housing Trust. So homelessness has always been a part of what I do. And along the way, all the different populations I've worked with, I realized the common denominator is really trauma. So that I have been working with Rainbows for a long time now, first as their director of programs and really bringing in first harm reduction and then trauma-informed care once we learned about that.
Good morning, I'm Larae Cantley, and I'm very fortunate to say that I've been doing some research on my own understanding of what I do. I have a 21-year-old who I've been working with the most, like right in front of my face all the time on this trauma-informed care practice. And I'm very proud to say that he's an amazing young man who is getting ready to go off to Kuwait to serve for 9 months for us in the Army. And as well, I have four in total, these little people who give me the greatest practice on a day-to-day basis. So the trauma that we have faced as a family, it came to a realization for me that I had some part in the trauma that they faced. And so I took a particular role in how do I address their trauma and be the best support system in their lives. And so it's opened these many doors to also being an organizer in the community, being part of the CSH SpeakUp advocate program, to be a core team lead for the Domestic Violence Homeless Services Coalition, and also sitting on the board for the LAHSA Lived Experience Advisory Board.
Good morning, everyone. My name is Erika Hartman, and I'm the Chief Program Officer of the Downtown Women's Center. We are the only gender-specific provider for homeless services for women in Los Angeles, and really recognizing how the experiences of women and trauma faced by women experiencing homelessness is unique, and the resiliency of female survivors is also really incredible and inspiring. I'm a licensed marriage and family therapist, and I started my career out working in an outpatient methadone clinic, providing mental health services. And I think that was really some of my first exposure to the different types of trauma that brought folks there. And then following that, I worked in gang intervention and working with youth in the juvenile justice system. And then prior to coming to Downtown Women's Center, I was the chief program officer at Westside Children's Center, where we really worked with families who had been involved in the child welfare system, working with youth who were in out-of-home placements and, helping them connect with their biological families and connecting them with new families as well. And so I think that all of that work really brought me to an awareness of all the different systems failings that bring folks into homelessness, and really gave me a connection to the backgrounds that have affected people, and the types of trauma that that really impact the folks that we work with now.
So the origin story, I think if we were all superheroes, I'd be Spider-Man who was just bit, because I'm coming to this work a little bit later than all of you. So my name is Susan Neufeld, and I'm with Bridge Housing. We're a big nonprofit affordable housing developer based out of San Francisco, but we do work in all the coastal states, including Oregon and Washington State. And, my introduction to trauma actually began about 4 years ago. We're definitely on sort of the tail end of the system when you're combating homelessness. We're the developer of housing where people land for permanent housing. And what we realized is that housing is just the beginning. It's not the end. And I think for a long time, we were really focused on sticks and bricks as being the solution. And then we woke up one day and said, oh, wait, people live inside our housing, right? Mm-hmm. And so we've come to trauma really out of an understanding that we represent bureaucracy, we represent system. Because we're an affordable houser, we are highly regulated. I'm sure many of you are familiar with that. And oftentimes we are an agent of re-traumatizing through the systems that we have to follow. And so what we started to realize is maybe we should actually look at this and think of a way to educate ourselves to do this work differently. And as I like to say, we can't necessarily change the what of what we do. There's paperwork, there's regulations, there's tax credits, there's all these things that we have to do as recipients of public dollars. But what we can do is change the how we deliver our message and our interactions with residents, and then also use that how to inform the system to encourage it to change. So I'm very excited to be here.
So I guess that makes it my turn, huh? So I'm kind of like you. I didn't get bit, but I keep getting dragged back, I feel like. I started out my career, I wanted to just be a psychologist like Bob Newhart. I wanted a place in my basement and a bed and breakfast upstairs. And I moved to Virginia, almost bought a bed and breakfast, but it didn't work out that way. And I came back. When I was in Virginia, I was the training manager of a large grant that studied PTSD in children. That was when we thought that children couldn't get PTSD. And we had a large grant about house fires, and how many people who have house fires, about 48%, develop post-traumatic stress disorder. You leave home, you come back, your stuff's gone. Mm-hmm. So that was my first introduction to trauma, and I thought, oh, that's great, and I did that. And now let me go off to my internship, and I wound up at Pacific Clinics, where many of the women that I worked with were survivors, probably about 85%. And I was dealing with their trauma, and I thought, great, okay, let me go to UCLA. And I did some work around HIV. It turns out a lot of people who have HIV are homeless, and they've had a lot of trauma. They didn't just wind up there. It's very rare to find, somebody that just winds up there after having this great life. So I thought, okay, let me leave for a little bit and go be a mom. And that was traumatizing. So I did that for 16 years. As a stay-at-home mom. And then I went to work with people with developmental disabilities because I had a child that wasn't what I expected when he was born. That was traumatizing. So then I worked with people with developmental disabilities, and I thought, okay, great. We're just going to start giving out services, and I'll just do that. And I was the one who, when they got sued, I represented the regional center. I was the one that went before the judge. That was traumatizing. But a lot of our adults, even though we pay for housing, were homeless. And had a lot of trauma. They're a very vulnerable population, and they're traumatized and victimized. I thought, well, let me go back to UCLA. And here I am. And now I'm training people in how people have a traumatic stress, how we participate in that, how systems participate in that. Turns out I'm not a micro person. So this is well suited for me to just kind of say, hey, yeah, there's a flaw in the system. I'm that person that walks in a room at your party and says, you should probably move the plates over there. So it works out that I'm here. So it wasn't what I expected, but apparently is what the universe had in store for me.
Great, thank you. So you can see that we really do have superheroes here. And I always think it's not fair for the moderator to ask these intrusive questions and then not participate. So I will just say that I think I am a sidekick. I got dragged in following my clients and then really bought into it and have my own passion for the issues now. But yeah, we can talk about that some other time. So I'll I'm Robin, I guess, Batman, Robin to Batman. Okay, so let's keep this rolling. What I'd like to ask our panel, and we don't have to go in order, so we can just popcorn. But if we were to shadow you for a day, if I was lurking in the corners with my notepad to do a story about my favorite superheroes here, what would we see your organization doing, and how would we know trauma-informed care when we saw it?
I think you would see us dealing with systems. And you're probably going to hear that word a couple times from me. I think, trauma obviously can happen at a very individual, very personal level. But I think, what I try to be a voice for is how systems also can exacerbate trauma or support resilience, right? It can work both ways. We are the landlord. We are fundamentally, that is our job. And so we have lease agreements, we have relocations that we have to do, we have home inspections, we have all the things that you can think of that go into landlording. And I think if you were to follow me around during the day, you would see me really advocate for a level of compassion and understanding in how we deliver that work. And again, because we certainly are working to inform the systems that create the bureaucracies that we all live in. But on the ground, we really try to also say, okay, we have to live within this system, but what we can do is show up differently. So one illustration of that is we're involved in 2 large public housing transformation projects, one of which is in Jordan Downs in Watts, if you're familiar with it. And very briefly, the plan is to tear down all of the very deteriorated public housing. If you've ever driven there, you know what I'm talking about. And to rebuild the public housing one for one, so there's no loss of home. And then also add in some higher density housing that introduces low income families to the mix as well. And we are looking also at some supportive housing as being a possible mix. And part of that includes preparing the community for this major transition. Folks have lived in Jordan Downs many times for generations. So they have a very strong identity with the community. It's been their home. They've seen the transitions happen. And there's a lot of fear that this is really an agenda around gentrification, which, I like to assure people that that's not the case, but why would they believe me, right? They have no knowledge of me or my relationship with the organization. And so what we're really committed to is what I call early and often communication and a high degree of transparency. I will not say for one second that we've been perfect in this. We have not been perfect in this. But what we try to do is really exhibit compassion for where people are meeting us and really invest early in that relationship so that when we do have to start doing all the regulatory housekeeping that is part of this job, that there's at least a basis of trust and communication that we can build on.
Thanks, Susan.
I can speak with that
Yes,
a bit.
please.
So I've had personal experience with the projects. My dad being, I always think about why am I sharing this, but it's my truth. But my dad had history as a notorious gang member, and we grew up in the projects. And so understanding that this particular way of living where the mind has been patterned that there is distrust, what I do, if you follow me around, is holding space, holding space for people to share. And I listen to learn. So I want to hear how their pains have come about, and then I want to kind of rebuild that trust with them. that I understand what it's like to have this patterned mind where you're constantly feeling like everything is just horrible and it's not going to work and no one is really here to support you. And if someone seemed like they were supporting you, what do they want from you? Holding space for these voices matters so much for me. And I usually carry around a notepad and a pen because I don't do this perfectly. I know that I usually encounter people that say, well, you don't listen. And so I take a note of that. What didn't I listen to? What didn't I hear? And how can I build this relationship with this individual that helps them to understand that although I didn't do this perfectly this time, that you're important enough for me to learn about you and to understand what is it that you need to be supported and how do I connect you to that. And even when they don't immediately accept those connections, how do I keep showing up with letting them know, well, this is another resource and this may work, or just the possibility of sitting down with them and having them sit with someone that I know and then inviting them to that table and saying, this is so-and-so, and they do this. Or just having like a real conversational meeting with that person where they start to understand like, oh, these are people who care about people and they provide services. So I don't no longer have to be afraid that the systems aren't working, but being able to understand that these are people who are going through this transition of doing things differently. And it takes time, and it takes practice, and it takes continuing. So this momentum has to keep going, even when it seems like it's not working, still showing up and still bandaging my wounds and saying, okay, that didn't work. What can work? Mm-hmm. And so me and my 8-year-old, we live in this world of imagination. Every night before bed, we think about what didn't go so well. And before we go to sleep, we think about if we can imagine anything being possible for that situation to have been different, what would that look like? And that helps so much for how we restart the day. And so I know it may sound a little foolish or a little childish, but this world of imagination, it helps me to be the advocate that I am, coming from that space of hurt and distrust and full of trauma and fears and this seed of a pattern that wants to stay with me every day and daily facing it and saying, you know what, that was the past, and I'm willing to look at this situation with new eyes and go and talk to some people who might mistreat me, or go and talk to some people who don't know how it feels to be in this situation, but do it with an openness of heart and knowing that before I go to bed, I could still reimagine what would that look like if it had worked perfectly. Mm-hmm. Thank you.
I think for us at the Downtown Women's Center, part of what we've really recognized is how high the stakes are for folks experiencing homelessness, that we're really the last line of defense. And so it's really incumbent upon us to do the highest quality work possible. And trauma-informed care and resiliency-informed care is the long game. So, we have to think about not just treating the tip of the iceberg, not just, doing the basics. We recognize that we have to start somewhere, and but that folks really come to our services and to our organization from all walks of life. And I think one of the things that's really incredible about homeless services is really the number of folks who choose to do that work because of their own lived experience. And I think we also have to recognize that with the prevalence of domestic violence, for example, that in an organization of 100 people, we recognize that the folks who are our colleagues come to that work with histories of trauma. And so in terms of how one implements trauma-informed care, it really is like a parallel process with the organization. It really is evaluating your policies, your procedures, the types of support you provide to your employees, because folks come with their own trauma, but they also are exposed to secondary trauma and vicarious trauma, and both in terms of what they're hearing on a daily basis and what they're observing. And so as an organization, we really invested in this commitment, and recognizing that our mandate is to do our best work, we conducted an organizational assessment to determine as a baseline where we fall. And from there we moved to train all of our employees. We provided training for the board. And we've made it really part of the fabric of our organization in terms of how we onboard folks, how we screen folks for this work. We established a trauma and resiliency informed care task force. And so it's a group of our employees that are from all different departments, all different positions and levels within the organization to provide feedback about how do we continue to support employees, how do we create opportunities to continue to boost their resilience, and really looking at our work through the 6 principles of trauma-informed care. And one of the things about trauma-informed care is that it's different for each practitioner, for each different work environment. And so it's really about figuring out what that looks like within your organization. How do you create safety? How do you create systems for peer support? And, we've looked at that as a service provider, in terms of, do we provide clinical supervision? How do we create, trauma-informed physical environments? Where do we allow opportunities for feedback from staff and from clients? And then how do we disseminate that? Making that available to other homeless services providers, going out into other service sectors, and, giving them the tools to operationalize it within their own organization. And just really realizing that part of it is to understand what is trauma, what is resiliency, and then how do you make a practical application for that? How do you make it distillable into interventions, into your interactions? If as employees, our resiliency is reduced throughout the day based on our, interactions with our boss or interactions with HR, that trickles down to how we treat one another and how we treat the clients. And so ultimately, it's really our responsibility to make sure that that permeates through all levels of the organization and out into the community for the people we're, there to support. So.
I can jump on that one because that's what we do at Rainbow in terms of looking at the parallel process of implementing and truly living the principles of trauma-informed care every day is not just for the people we serve, but for the staff who are serving the people we serve, to ensure that if we look at trauma-informed care as the shift from power over to power with, how are we sharing power by listening to the needs of our employees and supporting them in ways that allows them to be present, because we all have lives beyond this really incredible work that we do. And sometimes our staff needs a little more support. And I think that that's what we've realized over the course of our journey is how can we support those who are supporting people walking through our door. And we've done a lot to really create a welcoming environment. And that's what we work on each and every day is, are we really an open and welcoming space, and being able to examine our practices regularly about how we're welcoming people into the space, how are we supporting them, and starting with how can we help you versus saying, here's a 20-page intake assessment. Can you, go off to the corner by yourself and answer these first 10 questions that might be re-traumatizing? So that's a basic thing. It's like, let's just try not to re-traumatize people and start from there. But I think also just truly living the principles, not just for the people we serve, but within the organization and within all of our partnerships.
Yeah. I really appreciate what you said. In all the organizations that I've been at and that I work with, one of the key tenets of trauma-informed care is do no harm, but that is a lofty order, right? And so at some point in time, there will be harm. And so what we have done is really help staff to really understand the difference between asking somebody about what's wrong to what happened, and really talking about the experience. And there really are two realms that we often talk about, and it is those experiences that patients and clients bring to the table that they've had that have been traumatic. And we can talk about the ACEs, but also the traumatic environments in which people are in. So whether it is, in environment of poverty, domestic violence, poor access to healthcare, all of those different environments really play out. And so having staff really and volunteers and board members have a much more broader understanding of how trauma-informed care, and what we like to say is trauma-informed humility, because trauma-informed humility is a daily practice. It is not a one and done, we're going to train everybody, you're going to be trauma-informed, and you never revisit the conversation. It is really daily practice. Yeah.
Can I give an amen to that?
So I guess I would say for us, because we aren't seeing the individuals that you all serve, but we are working with your agencies, but I will take it back just to where we're doing inside. So we are fairly new, and training the thousands of people that we've trained in the last 6 months has been a feat, right? So we were like, we're waiting. Here's your money, go. And it has been absolutely bananas, right? I walked in January. I waited until January to start. And I walked in and they were like, okay, here are your 5 sectors. Plus you're making these 3 videos for the LMS. Plus you're going to star in 2 of these videos and figure it out. And we often say that we are building an airplane while it's flying. And that's how it feels. I think a couple of weeks ago, as we're getting up on the end of our fiscal year, it was really crazy. I mean, I was sending trainers out, and LA County is large. So when you tell someone who lives in Downey, you have an 8 o'clock training in Lancaster, good luck. It's 250 people. You got to lug all this stuff inside. It's crazy. And people get really, really stressed out. And it's a trauma in itself. And so one thing we do is we really try to embody the 6 core principles. We try to empower. I wouldn't say try, because I think I'm a pretty good supervisor, if I can say so myself. I empower I don't say to the people who are on my team, hey, I know life's been difficult. Here's what I'm going to do to make it better for you. I say to them, what can I do to make it better for you? What do you think? Imagine how I can support you. Tell me how I can make this sustainable for you. What can I change? What can I shift? So we empower them. We give them choices. Hey, you've got Lancaster today. Tomorrow, you want to rest, or you think you can keep going? So we're really trying to make sure that we do embody what we're preaching to everybody else, right? There is a lot. UCLA is really good with the well-being. There's yoga on the 6th floor. There's Zumba. There's gardens. We talk about it, and then we take a walk to the garden as a group. So we really make sure we're supporting and loving. We're not trying to be this negative. It's a lot different than when I worked in academia before. I'll say that. We're not making people stay there till 11 to fill out grant applications. We really are living what we preach. And we really are saying, oh, okay, you work till 11 o'clock today and you're 2 miles from home. Don't drive all the way in. It's okay. We really do want to make sure that what people are out there training people on, they know what it feels like in practice, and they can really translate that into real life. So I would say, if you're going to follow me around, put your tennis shoes on, because I'm constantly going. And I do. And it's my job as the supervisor to hold the space for them. Mm-hmm. They can come into my office and just decompensate, and it's fine. Mm-hmm. It's fine. I always have time. I never say I don't have time. I always have time.
Great. Well, I hope you will humor me in keeping the metaphor of superheroes going, but every great superhero has a great nemesis, right? So we'd like to hear a little bit about what's the toughest thing you or your organization has had to overcome, or has had to learn, or is maybe even still learning about trauma-informed care and resiliency-informed care. Where are you on that journey, and what battle are you still fighting?
I can start. I think that, we are about 75 to 80% government funded. And so trying to explain to funders how we implement our programs in a way that doesn't require people to attend services has been quite a journey. And there is a lot of talk of having trauma-informed care be a required model, though it takes a long time to shift the culture of an organization. And so we've done a lot of education of our various funders to say that the things we report on, these standards or the indicators that we have to meet may not always look like success to you, like in the traditional way that we have defined success for whatever reason, but we define success by ensuring that people feel safer, ensuring that they have good connections to other people, that they are creating new connections, and that they understand what resources are available to them in their communities. So a lot of our work at Rainbow on the policy level has been to try and help the city, county, state kind of have similar outcomes for domestic violence programs. And we were really successful, especially in the past few years, with getting some of our city funded funding to change their outcomes to reflect what success actually looks like for domestic violence survivors. And now I'm working on LAHSA and other county departments to do the same.
I would say that, in one of the organizations, one of the most difficult thing, and it had taken time, but it eventually started to happen, was really modifying physical space to be trauma-informed. And I'll give an example. We were seeing young children who possibly had been sexually abused when they were young, and that abuse went behind closed doors. And so when you walked into the space, you went down this long hallway, there were just all of the therapeutic rooms had these solid doors. So it was a simple modification of just changing out the doors to glass doors that had the transparency so that a young person who was going into the therapeutic room didn't feel like they were going into a closed door room, right? That simple modification costs a lot of money. So, planning for that and really making those long-term strategy environmental changes can really help.
I think one of the things that really comes to mind is buy-in around trauma and resiliency informed care. And I think that some folks have, either experienced or come from backgrounds where they worked in really punitive environments. So when, folks are encountering disruptive behaviors or risk behaviors, sometimes people want to say, okay, here is the punitive measure that we're taking, and this is the only way I know how to address this. And so I think that there's a lot of myth busting that we have to do around trauma-informed care, which is just helping people understand that it's not an anything goes. We joke about people calling trauma-informed environments the Wild Wild West. And those are really misconceptions in terms of, it's not trauma-informed to not create predictability and structure. That doesn't make people feel contained. That makes, that contributes to a sense of unease. And so I think that for us, it's really been about, in terms of who we work with, really being thoughtful about who our partner agencies are, how we work with folks, where we can offer to provide training and support, and then also looking at who we're hiring, how we're training our own staff. And so I think that that's can be a challenge, is both internally and externally finding the right people and giving them the right tools so that they don't feel free floating and don't subsequently re-traumatize.
I would say for myself, it's the internal dialogue that happens when someone who is traumatized comes in, shares space with me, and they're making comments that are like toward me, and me having to understand that it's not exactly toward me, but it's their way of experiencing life. And so having to go home and like decompress all of that and like have to have these self conversations where I've made some agreement to, I'm a horrible person and I don't do things well and this is not ever going to work. And even in the advocacy realm of when I go into a space and I try to bring in this new idea of the trauma-informed practices, and they're like, well, that's not how we do things around here. and then feeling like, oh, this is never going to work. And even, so for one example, my children who have dealt with many traumas, I do a lot of advocating at their schools, and I don't just go and say this doesn't work. I go and I say, well, there's a kindness program that incentivizes schools for taking on this kindness program, and they give you all the tools to be able to do it. And then later on, I hear that they have said some mean things to my children, like, well, you know what? Tell your mom she can tell the congresswoman that you're not going to be able to leave the class whenever you feel like you're just in this mood. Even though I've went and I've set up what they call safety planning. And so for me, is staying in the fight as an advocate, having this lived experience and understanding that there is a way for me to decompress and to separate from the thoughts that things aren't going to work. And what they tell me is that the world isn't going to treat you that way. And I'm like, well, if we keep on doing it this way, then eventually the world will see that this is a better way to do things. And so that's what my arch nemesis is. We will do this. And so I'm really grateful to be in a space where there are multiple people in different places who are also believing that this works. Thank you.
I have to be very careful about my nemesis.
Don't name names.
I won't name names, but I think for us, it's finding a balance, right? We have time. I think that's the thing we sometimes forget, is that we think we don't have time. And so we want to rush and get it done. We want to hurry up, move faster. And we don't say no. And I think that's the biggest nemesis, is I think we have to learn to be kind to ourselves. We're working on the trauma-informed, we're being supportive, offering choice, empowerment, but we're not compassionate to ourselves sometimes, and we don't say no. So our partner may say, can you train 60 schools at one time? And I have to say, no, because I want it to be good. So let's do small steps, a little at a time. We want to make sure the trainers are really knowledgeable, and we're training your people to be really knowledgeable, do this work. And they're going, but we've got 10 people lined up that can take this program. Can you accelerate it? And I think it's just learning to say no. I mean, our biggest thing is we want to do well. We want excellence. But we have to understand that excellence takes time.
So I'd love to ask you a follow-up to that, Sri. You're hitting on something that some of us were talking about before the panel this morning, which is how do you hold that space when you're operating in a system that has artificial deadlines? Like, I heard you talking about having to spend down funds before the end of the fiscal year. How do you hold that space as an individual or as an organization when you're in a system that doesn't honor those rules?
We have very diplomatic leaders. And sometimes we turn it back on that system, because the system, the one thing we found out is there are people behind that. And
No.
I know, it's shocking, right? There's actually somebody, the buck stops at somebody at the county. And that person, we have their ear and we say, this is not trauma informed. This is not going to create what you really want, which is sustainability. And if you want sustainability, you have to listen to our no. And that's a hard no. Mm-hmm. And it's working. It's working. But it came with a lot of building relationships, and it came with a lot of getting rid of our own implicit biases against what the county does, and how hard they work or don't work. I mean, sometimes we have these opinions about what's really going on there, but really getting to know the people and knowing that there have been people, when we're training DMH, we've been training DMH, and we are training 1,500 of their people before the end of June. There are people there have been there for 37 years. And it took 6 hours to figure out their training and how to approach them with their training, so they wouldn't be like, we already know this. Why are you here? Mm-hmm. We really were like, how do we create buy-in? How do we get them to do this? And we're like, we don't know. 37 years. None of us have been here 37 years. But it really was developing those relationships and understanding that communication is really building a relationship. And I think that that's how we do that.
I'm chewing on this one. I like to distinguish what and how. I say that a lot, right? The what is the regulation. The how is how we deliver, right? And I feel very strongly that our role is to be the person between the what and the how. It's to use the how to do better service to the residents. We call them residents. But it's also to use that experience to inform the what. And I think that it has to be both. I also think, when I think of trauma-informed work, I also think of it being very developmental. And I think we sort of get stuck in this advocacy role and don't necessarily look, and I'm speaking for myself here, I don't necessarily look at all the time at how to transition that advocacy to the people that I'm serving. And I think there's nothing more powerful than helping folks access have their voice access systems. Because at the end of the day, who am I to be an advocate to describe what it's like to transition out of homelessness or to feel like a vulnerable public housing resident? I just, I can describe it, I can observe it, I can share what I think I know, but that's not my experience. And I do think, Cherie, you hit something really important, which is assuming good intent, I think, is always a great starting point for those conversations. And Lord knows that I've had my complaints about systems. There are people in this room who've got to hear those complaints, very long monologues. But at the end of the day, if I want to change what is not working, I have to be in a relationship. And how do you have a relationship? You have to start with a common understanding and an assumption of good intention. And to your point, that requires us to, I think, go back in the corner and hydrate and replenish and eat nutritious food and have a glass of red wine once in a while. Yeah. So there is that element of self-care, but I do think that that's really important to keep in mind. The other thing I want to just add, I have so many thoughts here. Erika, you said something so valuable, I think, which is this idea that trauma-informed and resilience-informed is fundamentally about being flexible in our ability to be compassionate, right? That's kind of the simple way. And I'm not looking over there because someone gave that to me and I'm stealing it. But at the end of the day, I think the hardest thing in my organization is how to train people that this is not a handbook, it's not a protocol, it's not a curriculum. What it really is a sense of guiding principles and then empowering people to have that judgment they need in the moment to exhibit those principles above and beyond whatever protocols we've put into place. And that's a really, really hard thing to train. And it's also a hard thing to reinforce when common work culture is fear-based and punitive-based, particularly when we're also working in a regulatory system that includes funding where you get those, thick descriptions of outputs and outcomes and objectives and paperwork and money spent and all this stuff. I think the hardest thing in my organization is how to reconcile all that and how to really be the barrier between that junk and what the resident experiences, because it's not on them to have to deal with that. That's on us.
To speak to what you said about the what and how, I think that a lot of that is also thinking about what is your implementation process and have you filtered it through these principles? So what is the environment in which you're delivering this message? Even if you're, presenting what has to happen, have you solicited feedback about implementation? Do you continue to maintain that sense of trust and integrity with the folks you interact with so that they know you have their best interest? And where is the transparency in that? Can you prime people for these hard decisions or the things that have to be implemented? And I think that, continuing to look at, where people are and, again, it's not about the what, it's really about how is this implemented? Can we make it digestible in a way that people can assimilate what's going on? And, that's really true of, the folks we work with and, on both sides, as colleagues and the folks that we serve. And I think that, sometimes when we look at implementing something, we look at it from the lens of, okay, at most, I'm going to ask my colleagues about how they want to implement this. But recognizing that anything you do within the organization intrinsically affects the people that you serve. And so can you solicit feedback? And even if you can't implement exactly what that feedback is, there's enormous value in people feeling heard. Yes. And so giving people an opportunity to express their frustrations, validating those frustrations. Sometimes we talk about thinking about how can you, if you have to say no, having given it your best effort and explored other options to see if there was a possibility to implement this suggestion so that at least you can validate the individual who put it forth, by saying, we looked at this option, we tried this, ultimately this is where we ended up having to land, but we heard you and, your voice was valid. And so, we really want to honor that. So, again, going back to, have you filtered these things through these lenses? Is there a safe environment? Can you provide some food when you have to make that difficult announcement? Whatever it is that gives people a sense of comfort so that they can, absorb things. So. Mm-hmm.
Erika, I really appreciate what you just said, and I have been leading a learning collaborative over the last 6 months on trauma-informed approaches with community development organizations. And so one of the practices that we put in place for the staff to begin to use on a regular basis, so whenever they have a meeting, at the beginning of the meeting, there's a check-in. And the check-in there are 3 questions that you answer, and everybody in the meeting does this very quickly. How are you feeling? Good is not a feeling. So, how are you feeling? What is your goal for today or for this meeting? And who can support you in reaching your goal? And it really opens. It's reflective. It also allows people to hear each other, and it also reinforces this desire and need that individuals have for support.
I keep reflecting on the whole phrase, we're doing the best that we can with what we have. And that's how we see the survivors who come to us asking for help. They're doing the best that they can with what they have, and we're doing the best that we can with what we have. The domestic violence system of care really has been a crisis-oriented system since its origin. And I think what trauma-informed humility has brought us is the space to slow down a second and say, does this decision have anything to do with safety? So if we're always operating in this crisis orientation, we're being really reactive when we may not necessarily have to be reactive. And so as we went through this journey, one of the things we did in getting rid of all of our shelter rules and transforming them to guidelines was asking, does this expectation or guideline have anything to do with safety? And then we started asking staff that, like when we would get called at 9:00 at night, like, is there a safety issue happening here, or are you just needing some support? And then in both of my leadership roles, when I'm asked, we need to make a decision on this, it's like, does it have anything to do with safety? And can we have some time and space to really think about what would be best for this individual or family? Do we have time to confer with them about what they think would be best? And if I don't get back to you in 2 days, please ask me the question again, because I may forget. But I think it just has really given us more time to think about how can we approach our work that isn't so reactive, unless we absolutely need to be, because there are definitely still really super dangerous situations that our families are facing. Though I think the domestic violence field overall is starting to recognize that that's a small percentage of the people we serve. So out of the 600 individuals and families that come to Rainbow each year, and that's the adults, only about 75 go through our shelter system. So we have all these other families we're serving that may not be in as dangerous of a situation, so we may have a little more time. And also giving the individuals and families more time to think about what is best for them and their family.
I'd like to reimagine. So when I think about the deadlines and how much funding has to be spent within a certain amount of time and all the boxes that need to be checked, I think about bringing the lived experience voice in the same room with the funders. and having them to understand that when you're dealing with trauma, there is no let me do this by this time. So from my personal experience, for everyone who has any knowledge of the Nipsey Hussle murder, so we were working on this really great summit presentation on trauma informed, and as I was sitting there and I was hearing about the murder of Nipsey Hussle, and I have an 18-year-old who is also recovering from being shot, and I have my 16-year-old daughter who was like the first responder of my 18-year-old who was shot, and I have this 8-year-old who just like totally lost it when we got to the scene. And so what happens to me when there is a immediate trigger of my trauma is I'm not able to be present. I'm not able to make any decision with certainty. And so when we're able to bring that voice in the same room with those who are making these requirements, then through those relationships, hopefully there's this courage that is taken that can begin to see, okay, with trauma informed, there isn't a real need for these strict deadlines. Let's create some flexibility. Let's look at how we can do this to where the people that we're serving feels like that door is open for them when they're ready to come in. So yeah, that's my idea, is bringing the voices with the funders so that those relationships can be established and there'll be new ways of implementing systems.
I just want to echo what you're saying and just say it really loud and clear. Accountability and trauma are not incompatible. And being trauma informed and being accountable can work together. And I think that's a huge misunderstanding, that you can create systems that hold people accountable for the resources that you're giving them and still have that flexibility and that trauma informed perspective. So thank you.
Thank you.
Just want to let that sit for a minute. That was really powerful share. Thank you. So one more question for the panel before we open it up for all of your questions, because I imagine you have many. In the spirit of what you were all just sharing, what trauma-informed superpower would you gift to our leaders to realize the vision of ending homelessness in Los Angeles and beyond?
I got one word: humility. I mean, it was said before a couple of times. I think humility is the key to everything. Recognizing that we don't have it completely figured out and that we are learning. And I think that humility is going to help us grow and evolve.
So I don't know if I should answer that because you just said yours was the answer to everything, but I'm gonna
That was a particularly unhumble answer. Humility advocate.
I think the word that just popped into my head was choice. And the reason that popped into my head, because I think about my work with people with developmental disabilities for years, where you said, oh, you have a developmental disability and you're 18 and you want to live on your own. You don't want to live with your parents. Great. Here's these 5 people living in this house and you're going to be their roommate. I mean, I got to choose who I live with.
Right.
I also got to choose where I live. And I think that when we start to say, oh, great, we've got this affordable housing, we're going to put everybody all over here. They're taking away choice. What if I don't want to live there? And I think giving people, constituents, the power to say, not in my neighborhood is a problem. And it keeps people in places that are not always safe, don't always have the best education, don't always have accessible services. My doctor's office may not be there, may not be on a transit line. I just think choice is a big word because it encompasses so much when it comes to where people live and how they choose to live and who they choose to live with, and then being creative. I mean, creative in how that's done. Even, what if we want to live in a duplex together? What if we want to share our resources? And we can't because there are constrictions on the system that say I can't share what I have with you because then you're going to reduce how much I have of that. So I think choice and creativity really just pop out for me.
There's so many. I was going to start with empathy. and maybe I'll just leave it there. Empathy, like all around, for the work that we do, for the people that we serve, for the organizations, for all these different systems, just empathy about people's own experience and how each and every person who comes to us is an individual and very different from the last person who walked through the door.
Yeah, I totally concur. And I would add on there, especially for leaders, awareness. If you had a superpower to be able to see and understand people's past experiences and to be able to not re-traumatize individuals and to change systems so that they're supportive would be an amazing superpower.
I think what comes to mind for me is recognizing that individuals are the experts in their own experience and really being open to what people have to share and, recognizing that, we don't know everything, that it's not just the person who's told you they've experienced trauma that may have experienced trauma. You don't know what the person next to you's experienced, and giving people the space to share and to solicit feedback, I think is incredibly important. And, being patient with yourself and, recognizing sometimes we're so focused on everybody else that we're taking care of, taking time to recognize our own experiences and have that self-reflection and, seeing how we show up every day and, how does our life experience present and, can we translate that into something positive? But I think a lot of it is around awareness and, giving people, the space to show up authentically and, not personalize, whatever presents.
I would say reconciliation. So with the experience that I've had, I don't want to throw people away. I understand that these people too have come from very challenging backgrounds. I love my family, and we have had great challenges on how Larae is today versus how Larae was patterned to be. And as I walk into new spaces and I get to know new ways of being and new characters and new personalities and new ways of thinking, I always feel like there's a disconnect. So there's a disconnect with me and my family who grew up with these similar experiences, but I feel like I don't have to stay in those experiences. And as I'm in this weird hallway into coming into this very healthy way of living and being, I don't always feel fully embraced by those who have had this lifestyle of being accepted and appreciated and knowing what it's like to have that support. So I think just being reconciled to oneself, the core self, and able to be reconcile with those difficult relationships, and also being able to reconcile with this newness of who I'm stepping into, and always be able to come into these spaces where there's a diverse people brought together, but feel like I belong. Yeah.
Wow. I'd vote for that person. Great. Well, thank you so much. Let's open up the discussion to all of you. What questions, comments do you have? And I know we have a couple of microphones going around. So, Nicole.
Hi, Nicole. I don't know if this is on. Nicole Fiore, Apt Associates. First, I just want to thank you all for bringing all this wealth of information and knowledge and experience to this room today. It was really a wonderful panel. So thank you so much. So as I'm sitting here, I am a researcher with Apt Associates. I work on a lot of community evaluations across the country. And I'm sitting here thinking about all the evaluation that is going on in the Los Angeles community around housing and homelessness right now, especially funded through and requirements through Measure H. And I'm thinking about how we as researchers in the research community all need to be trauma informed, because we are doing a lot of data collection and interviews and focus groups with people who may have had trauma in their life. So my question is, how do we all become trauma informed?
I'm not going to answer that question, but I want to zero in on something you just said, because I see this front and center. Again, I'm more of a landlord, even though I oversee services and evaluation. I'm more of a landlord than not a landlord compared to the folks on the panel. And this has kind of been a revelation for me. I don't know if it is for you guys, but paperwork is traumatizing for a lot of folks. And there's a lot of paperwork in evaluation, in leasing up, all these things in accessing services. And I think it took me a minute to really understand the act of having to get all your documents organized, the act of, finding your social security card or making sure that you have your birth certificate. For folks who are undocumented, the act of having to identify yourself. Like all those things can be traumatizing in and of themselves. And then you layer in a research perspective where you're not to, this is neither good nor bad, but sometimes in research, we're asking people to open wounds, right? And so, one of the things that I've come to that I'm a big believer in is some sort of community participatory role in evaluation and research. Now, CBPR, as you know, is like a pretty rigorous method and it may or may not work, but at least having the residents that we are going to study participate in giving feedback and design insight into the study, and then also mirroring the results back to the community because it is their data, they own it. I think that, it sounds so intuitive, but I don't think it is actually a really scaled activity. And particularly in communities like Jordan Downs or Potrero in San Francisco, these are communities that have been studied for generations. These are communities who've been, they've either experienced firsthand or have heard of, studies like Tuskegee, right? Things where research was used to abuse and exclude. And so I think the sensitivity as an organization that we've come to is when we invite, because we don't do first person research, but when we invite researchers in, the first thing we ask is, how are you going to do this? How are you going to engage the community? How are you going to present the results back? And do that first. That's the priority, not the publication. That's the priority. And so I think to be trauma informed is to be knowledgeable in what the practice of trauma informed is, but also to say, okay, now how do we, someone said this beautifully, which is how do we filter this through the work and how do we look through everything we're doing in that lens?
I like what you said about soliciting feedback because you can get at the same information in different ways. So, hearing from the community that you are going to be gathering data on about, this is what we're trying to elicit. What is a way in which we can ask this question? But I also think part of it is taking time with informed consent because I don't think people fully understand their opportunities to opt out. And then the other aspect of that is, bringing it together at the end and giving folks the time to debrief or giving them resources that they can access. Maybe immediately following a research questionnaire, somebody doesn't, fully assimilate what they've communicated. And, later on in the day, later on in the week, they really recognize that they need that support. And so having people have that opportunity to, connect to a service provider, come back and talk to whoever's conducting the research, I think can be really valuable.
Yeah, we are really conscious of how much we ask of our participants. We do a formal evaluation twice a year with them. And so I think they've gotten a bit used to surveys. And definitely when researchers approach us, it really depends on what's happening and at what point are we in the year where we've already asked a bunch of questions. But definitely looking at those things and working with researchers to say, is there information we can pull from our database that would, different routes without necessarily putting another survey in front of our participants.
One thing that we've started to do at the LAHSA Lived Experience Advisory Board is we would look at the surveys and we would kind of like evaluate how those questions on the survey can be triggering, and then we help them to like reword it so that it could be more of an at-ease experience for those taking the surveys.
So I'm going to try and answer your question. So I think that the good thing is that you're asking the question, right? How do I do this? And doing this work, there's a lot of information out there. And I think just knowing that, this is what I want to do, reaching out to people who do the trainings and asking and attending. Our trainings are free. Our consultation is free. Our coaching is free, especially for someone who's out there doing the work. So the things that the panel has told you, that's one of the things we do is we help you go through your research questionnaire and say, this question, maybe we need to use this word. Maybe you want to have a disclaimer or a soliloquy before you say this piece, or how are you going to close the circle once you've opened it? And so I think that the fact that you're asking the question is a good thing, but then going forward and just finding those trainings, there's a lot of online things. There's a lot, I'll give you my card, but I don't know where you're located, but there's so much information out there, but it's really understanding those 6 core principles and filtering, like she said, and taking it to the advisory boards and saying, okay, this is what we want to do. How can we do it in a way that's not harmful?
I think, trying to follow what you said about CDPR, trying to really follow those principles if you can, like exploring it more. And I think we run into the issue then, because I'm thinking like funding, time, we run in, because our grant funders may not understand the time that it takes too. So like when you're developing an interview guide with the individuals who've had that experience, that it's going to take more time, or that having to share that. So I think flexibility is kind of coming back to trauma-informed care, to research, as well. I'm happy to talk more too.
I have a question. My name is Delina Sasayama. I'm with the Department of Health Services, Housing for Health. Thank you all so much. This was an amazing panel, and I really appreciate all of the different voices and perspectives. So I'm in the kind of odd situation where we are a funder, and we fund these incredible services. We have really great trainings. I have one of our trainings right here, trainers sitting next to me. And so one of the things that we really try to do is build these relationships with our community-based organization partners who do the work. But unfortunately, we do have to turn our data over to the Board of Supervisors, and we have to show certain outcomes and meet certain metrics. So how can we continue to be a good partner, be trauma-informed, client-centered, while still kind of push and ask for this information without, blurring? I don't know. I guess it's how can we continue building this relationship while still receiving the information that we need without sounding too harsh, I guess.
I think an example I can give is we have city funding, like I shared before, through the domestic violence shelter operations. It's overseen by HCID, which is Housing and Community Investment Department, the city. And prior to the release of funds and the RFP, they sat down with the shelter providers that were already being funded and said, we're here to listen about what you think would be successful outcomes and what outcomes do you think would make a good story. So, and we didn't get everything in there. We got a lot in there. But I think just the willingness of the department to truly bring people together in a way in which they're listening, and then to actually see things change. Because prior to that, we were our outcomes looked like outcomes from the Family Source Center, which didn't apply nearly at all to the families we were serving, so they really listened and they actually changed.
Sorry. I think one thing, you're doing change management. And I think change management, I can relate to a little bit because I'm not a funder, but I have a board, and my board is composed of developers. So the minute you get out of pro forma language or construction timelines, their eyes glaze over a little bit. And so most of their experience really is in being a donor to a nonprofit and getting those outcomes as a donor, right? So getting, the impact of a charter school on test performance. And so they tend to be very quantitatively focused. And I think the way we've started to do some change management is not to resist what they understand or the language that makes sense to them, but to couple it with something that represents a new language. So the qualitative data or new terminology, or educating them on new concepts that are not familiar or part of the common language. And I think, what I've seen is that really is creating that openness to evolve. And I think, as someone who used to go to Board of Supervisors meetings, I think, you are doing change management, and you're not going to get them to reverse the ship overnight. But I think being very intentional in how you communicate, offering, here's what you're asking for, and, oh, by the way, let's share some qualitative information, or let's share some feedback that we got. I think it is a long game, but I do think that eventually that will land with somebody who then can really be your champion for dramatic change, I believe.
We are a housing for health service provider, so I get to see firsthand how a lot of the way in which housing for health is structured incorporates those 6 principles. And I think that that's really incredible. And I think, capturing some of the success around those principles. So, for example, the client satisfaction surveys, or the number of staff that are participating in the vicarious trauma trainings, or, all these things that are actually indicators of the ultimate success rate that we're seeing. So, what do the service plans look like? Giving people, opportunity to, participate in other ways or communicate their voice. And, I think that we see this a lot in terms of as we're building out workforce development specifically, because workforce development's historically, who's placed in a job, what is the retention rate, and recognizing that there are more metrics in there. So, what are self-reports of increase in self-confidence, or, whatever it is that is really ultimately the building blocks for these outcomes, and making really clear that they have their own value.
Mm-hmm. Mm-hmm. I have a question. Thank you all so much. I'm curious, you've mentioned principles a few times, and the 6 principles especially. I wonder if we could get a list afterwards, and we don't have to go through all of them, but I'm wondering the actual principles would be helpful for, I think, I'll speak for myself, not knowing them, to just go through them and understand them more fully. And as you do them, I'm curious, for the system, what are additional specific system issues as you train providers, organizations, participants? What are the things that organizations get stuck at regularly, where they say, if this doesn't change in the system, I can't do it here, and things that need to be exemplified further in the system?
That's an interesting question. I mean, I think we have to take a step back, because that's important that we kind of tell you what those are. And I can just tell you that they incorporate safety and support, choice, collaboration, empowerment, trust, cultural factors. And I don't think that in any of the trainings that we've had in agencies say that those were difficult, because when you think about it, they're actually really simple. How do you create safety in an environment? Emotional safety, physical safety, make sure the lights are working, maybe not have your security guard be armed. Those aren't hard. I've never had an agency say it was difficult. In fact, we always ask them, what are you already doing that embodies this principle, and what more can you do? And they never have a problem coming up with an answer. I would think that if in some of the agencies I've worked for, one of the hardest ones was collaboration. Mm-hmm. Because we have guidelines. I know you want a pony for your child because it helps them to speak. Maybe they're nonverbal and they have an ASD diagnosis, but we can't give you a pony. But what we could do is we could find a place that gives pony lessons for free or on a sliding scale. So even when you think a little further, collaboration may be difficult because we say, oh, we don't want to tell them everything. We don't want to give them everything. But transparency, that's a part of trust. It's building trust. Mm-hmm. What can you share? And so I think that if I were to think about it, that might be the one. But then when I start thinking creatively, I'm like, oh, it's not that hard. They're really not difficult pillars. they're just, I think a lot of the work is already being done. It's knowing why we're doing it and doing more of it.
Yeah, and I would say, one of the things that I would hope occurs when an organization starts to embrace trauma-informed principles is that it becomes a core value. Mm-hmm. And if it's designed from the board to the organization as a core value, along with the other core values of respect and dignity, and then it intrinsically will continue to permeate the organization. And I always like to say infuse. I would love to infuse a trauma-informed perspective here.
And I think about, think about the trust and transparency too. How do we instill that with the survivors that we serve, that we trust that they are the experts in their own lives, and from the funders to the organizations, are they trusting us to do the work that we've been paid to do? And then the transparency too. I think from a funder's perspective, we get asked so many things, and I'm constantly asking, why do you need this information? They don't always know. And I'm like, okay, well, until you can tell me why you need this information, I don't know that I'm going to waste my staff time in collecting it. So I think that transparency is so important on all levels. And I think as we, went down this journey and still are, we share a lot more information than we ever did with our participants as to why certain decisions have been made, with our staff as to why certain decisions have been made with our board. So I think that is really important in building trust and knowing that takes time. It takes time to build trust with people who have experienced trauma from a very early age. Mm-hmm.
Yeah, and I think so. They sort of mentioned the 6 principles there, but I think that ultimately, really, what those tie to is resiliency. So thinking about these things that ultimately boost resiliency, and so physical safety, emotional safety, trust, transparency, communication, peer support, and I think that where I see folks struggle sometimes is in the peer support, and in part because it requires an organizational investment. Both in terms of how do you structure that in, where do you commit the time, and so some organizations build in clinical supervision, for example. We do self-care buddies, so everybody's matched with somebody else in a different department, and part of the intention behind that is to help anchor people across the organization, but also so you have somebody at the end of the day that you can honestly have a conversation with. And I think in terms of the collaboration and mutuality, that's really about getting feedback. What would feel supportive? What can we incorporate? What does this look like to you? Empowerment, voice and choice, and thinking about, that looks different for everybody. Is it being part of the decision making? And I think that, another aspect of the cultural, historical, gender-based trauma is helping people understand epigenetics and how trauma can move between generations. And, that even if somebody doesn't have a discrete experience of trauma, that they, have encountered systems of oppression that brought them to this particular place. And, really providing training to staff around cultural humility and how to create affirming environments and create that sense of safety. So, but I also think that some of it is challenging what has been business as usual, for example. And even thinking about, sometimes people say, well, I can't share that information. It's like, why? Why can't we share that information? And, if people are looking at it from the perspective of, personnel information, salary information, okay, we don't share that information, but can we talk about changes that are coming? Can we prime folks for those things? And, just giving people an opportunity to say, okay, that's too much information. I don't want to know about the financial health of the organization or whatever it is. So, but really, again, that's giving, that empowerment to say okay, enough information. Mm-hmm. So I think that it's bringing all those together.
Mm-hmm. I agree. So I have a question a little bit about this trust. We can't legislate trust. You can't tell people to trust. You can't tell people to stop being in fear. And this is a very fear-based culture. And I think the service providers, as well as on both sides of the service, trauma is ubiquitous. So fear is there, while it looks nice, the principles look nice and easy on paper, in reality, it's not something we can even legislate with ourselves.
Right. Mm-hmm.
And so and I think it also, this idea that we can put it on paper or we can do these activities, but what I find left out is the body. Like I do embodied work because trust comes, it's bottom up. And so I would like to ask, how are you addressing this? Because we have culture where we're these little walking heads. How are we addressing this, that bottom up piece, and bringing that along in organizations, knowing that change and going into the unknown also triggers fear. So even when you talk about innovation and change, you're now like stoking somebody who's worked for 37 years, their fear is way up. So how are you bringing the body along with this?
Yeah. So a mentor of mine said something that, has stuck with me forever, which is you can't give what you've never had. Right. And I think that's fundamentally what you're saying, is that we can write the academic concept of trust, and we can certainly, standardize the practice and write the manual and all that. But how do we show up? And I think, I don't know that I have the answer. I'm going to actually be humble this time. But I will say, this is deeply personal work. And I think that, if you go to any, sort of modern business school these days, the first thing they teach you is to understand yourself and what you are bringing to the situation, where your deficits are, where you'd like to grow. And I don't think we do enough of that. I'm struck by the conversation about systems, and I think I warned you guys that's where I would stay. And what I'm struck by is that there's this sort of mutual dependence that we have, like we need money, they need us to do services, but we don't often sort of enter into that conversation on equal footing. And I think at the end of the day, what I've determined, and I struggle with this all the time, is that the best thing I can do is have courage to speak truth to the systems that I think are dysfunctional. And that's really, really hard to do when you subconsciously or consciously believe that they're writing your paycheck every single day, right? That's a vulnerable feeling. But at the end of the day, I have to bring my body to the space as that voice. And as I've known Joelle for a long time, as she knows, I like to say, then if it doesn't work out, I'll quit and go work at Starbucks, right? Because at the end of the day, like, what are we here to do? Are we here to serve a system, or are we here to use the system as a tool to serve the people? And I think that's a question we all have to reckon with in our own lives, to figure out, like, where is that point of courage for us? I don't think that answered your question. I think I did a politician thing where you sort of pivot, but what I do appreciate, and I think what you're hitting on, is this idea that this is not an abstract thing out there outside of us, right? This is a guiding philosophy that we have to engender in ourselves first before we have any hope of conveying it to the community or conveying it to the systems.
Mm-hmm. So I'm going to be an agent of the system right now. And we have hit 11 o'clock. I don't know if there are any, I really want to thank the panelists and give them an opportunity to make any final statement that they would like to make. And then I know Gary's going to do our closing.
So I'll just be really quickly try to say something about what you were saying about trust and creating these things. We try to not approach this as an academician coming in and telling you how to do the work, which is why one of the things we do is ask them for the answers. Mm-hmm. How are you embodying trust? Is it calling back when you say you're going to call back within 24 hours? Mm-hmm. How can you find and do more of that? And then a lot of the work we do when we talk about building resilience is we build resilience in the people so that they can then go build it in the people out there. Mm-hmm. It starts here. Mm-hmm. Find your why, build your own resilience, deal with your own stuff, and then help the people. Mm-hmm. And I think we're just so honest and raw in the fact that we have everybody in the room. And I've already talked to the administration when I walk in that I might hurt your feelings, but you have to do this. I can talk to you about it all day, but don't walk out of here and say I didn't give you something if you choose not to use it. Mm-hmm. Mm-hmm. And I think that's the piece that we have to embody, is that it's personal work. Like she said, it's personal. You choose not to do it. Don't blame me. Mm-hmm. So.
Amen. Trauma-informed care is a lifestyle. Mm-hmm. It's not something that you just do at the workplace, or that you just say, oh, okay, now I feel like practicing. Oh, now I'm going to pay attention. But I've understood from the time that I wake up, because I have these little people in my home who I prepare myself for before I even go and wake them up, because embodying the lifestyle of trauma-informed and understanding that there are multiple traumas within everyone. And if we're all living in a world with our traumas, and if we're all just focused on how do I not trigger my own traumas, then we're constantly triggering others. So I do think that the internal work is very important. So I wake up at 5, not because I want to, not because it's like this idea of the successful person, but because I am aware of the patterns that have been given to me as a small child, and has developed me as this woman who now sees that the best way to take care of myself and these little people that I've been responsible to in the world around me is to embody. And so it was so funny the other day, my Army son had come home and he was watching me watch this program on Gaia, which is a higher consciousness app. And he said, Mom, is this all you do with your life now? And I said, yes, and I love it. So yeah, the lifestyle piece is just take it with you everywhere you go.
And I just wanted to share around the trust that we have to look at the cultural, historical, and gender issues when we look at building trust with survivors, with our staff. I mean, everyone has a different experience, and that intergenerational trauma, I think, really affects our ability to create trust. So I'll leave that there.
I like the idea that, we've landed on trust sort of for this closing piece, because I think that a lot of what we've talked about has fallen into that and building trust. So, when you think about the humility or, being vulnerable and, giving people a window to see you for who you really are, trusting that people have noble intentions, that they're doing the best that they can. And, just really giving that power to the folks around you to, provide you that feedback and be open to it. And also being brave enough to step into providing feedback, and having, challenging conversations and, trusting that somebody's going to receive that. And, I think one of the things that, resonated with folks when we talked as a team about trust building, it was really about, getting to know the people that you work with, getting to know your clients and, just creating that space where, you can be honestly vulnerable, that you don't have to be the expert. You don't have to be, tell people what to do. You can hold that humility and, say like, you tell me what's best for you. And, I'm here and I'm open to hear it. And I'm here to hear the mistakes that I've made and how I can continue to be better. So.
That's great. Well, I just wanted to sincerely thank everyone who participated in the panel today and then also before. It was a very powerful, not just set of facts, but also just kind of infuse what kind of world, and I think Larae said this earlier, like there's a world that we want to be a part of. And so that means that when we're interacting with the systems, whether we're researchers, whether we're providers, whether we are funders, that there's a new way that we can think about doing that that's going to be much more effective than the ways that we have experienced growing up. So I recognize this was also a heavy kind of panel because we had to face into the things that maybe in our own organizations we do or don't do well. And so I don't know whether the appropriate solution would be an extra half-hour lunch break, something else along the way. So just to enable ourselves just to process this. But this is not something that's a one-time thing, but we'll just need to return to think about how we do our work better. And again, let me please join me in just thanking everyone that participated today.